Hello, my name is Tyler Harding, and I will be talking about specific recommendations for exercise programming for peripheral artery disease patients, also known as PAD. Alright, in this slide, we will be talking about specific recommendations for PAD patients. So it has been proven that exercise can restore PAD, as well as increasing physical activity can minimize symptoms in PAD patients. And patients that do more leg circulations can reduce pain complications within them. For PAD, there are 4 stages, and the first 2 stages that patients are in can do exercises like walking distance and increasing walking distance are very effective for PAD individuals. Like what we said earlier, more leg circulation reduces pain complications. But for stages 3 and 4 patients, they need to be resting instead of doing some sort of exercise or physical activity, since their pain level is probably at a very intense level. Next, we will be talking about specific exercise recommendations for PAD. Some exercises that can be done are upper body ecometry, cycling, and low intense walking. These exercises are very beneficial for PAD patients since they improve the ability to walk and other functional movement statuses. As an example, arm econometry exercises can increase PAD patients' walking performances. Another way to increase exercise for PAD patients is to have a supervised exercise program. These are beneficial for patients since there's someone that can give them the correct exercises to apply to them and that they are not carrying out incorrect exercises, as well as having someone motivate them and to tell them how much they need to be exerting within the exercise that is not at extreme nor at a minimal level. Treadmill exercises are very good for PAD patients since these exercises are very effective for resistance training and works the cardiovascular system. Finally, we are going to talk about programming exercises for PAD patients. Since we have been talking about walking throughout this presentation, we are going to focus on an exercise programming for walking. So first, PAD patients should warm up by stretching lower body, such as calves, hamstrings, quads, anything waist down. Next, they should begin to walk, and they should walk at a comfortable to moderate pace for 5 minutes minimum. Then after that 5-minute walking session, they should rest, and they should rest as long as the pain level and fatigue go down. Next, they should repeat walking and resting for at least 35 minutes. After the 35 minutes, they should cool down and walk at a slow pace for 5 minutes during the cool down session. So for this exercise program, it should be done first for 2 months and should be done 3 to 5 times a week for 35 minutes. After the second month, walking sessions should increase by 5 minutes every 2 weeks until sessions meet to be 50 minutes. Then from there, walking sessions should be 50 minutes every 3 to 5 times a week. So the level intensity should be done going uphill, upstairs, and even on incline treadmills. And the last thing are my references.